This is the Michael Brighton Show. Hi everyone, welcome back to the Health Series, and I am joined with Dr. Joel Beckett, who's a dual fellowship trained neurosurgeon, and we are focusing on spine, the back, and back pain to do with health. So, Joel, thanks so much for joining me today.
Mike, great. I'm happy to be here.
In the realm of back pain, then, loads of people experience it. I imagine it's one of the most common pains that people feel. Break down a little bit as to why. Why is back pain so common?
Yeah. You hit the nail on the head, so to say there. There was a pretty famous study back in 2020 from the WHO that essentially it found that back pain is the most prevalent cause of disability worldwide. The most prevalent, not just musculoskeletal, but in looking at kind of the amount of disability burden that it puts on the population of the world over time. Back pain was number one. They estimate something like 800 or 900 million cases per year, a significant fraction of the world's population. And fundamentally, it's a great question to ask, kind of why is this? And, when you break it down, the spine itself is, critical kind of component of our body. It allows us to maintain posture. It connects really our upper body to our lower body. It's involved in every motion and movement that we do. And it's supported by a large network of muscles, both in our back and our abdomen. And, the flexibility and the adaptability that our spine has, the kind of the degrees of motion and the degrees of freedom that are built into it, make it very susceptible to wear and tear. And the spine's health, it's critically important to maintain good musculoskeletal health and strength and posture to maintain the health of it. And you imagine we're living longer than ever. We're living more sedentary lives than, historically we've ever have. We sit more, and sitting is a terrible posture for our back and spine. And taken together, all of these things, it adds up, makes sense. It's relatively straightforward to see why we're having so many problems with our back in kind of the modern population.
Be curious as to whether we're actually built to be healthy, even in just our back generally. Because as you say, we're living longer. Is it not just a case of what's helping us is also not helping us as much?
Yeah, a little bit of I agree with you. It's kind of a philosophical question in some ways. We as a general whole, yes, we're living a lot longer. Modern medicines and antiseptic techniques, and we can fight off infections and vaccines and all of that and help us live longer. But in our modern life, we're much more sedentary, which, yeah, I guess we're not, as at risk of getting attacked by predators and things like that, being indoors in front of a computer all day. But we're also not engaging kind of our muscles how they're supposed to be used. And because of that, as time moves forward, particularly our low backs, bear this kind of essentially it's an unnatural, it's an unintended kind of weight loading over extended amounts of time, over longer amounts of time as we live longer. And I think that you're absolutely right. This is kind of one of the side effects, if you will, of living longer and of kind of living the current existence that we do.
I find it fascinating as well when you speak to people that whether they suffer with back pain short term or long term, usually they describe it as different sensations or different feelings, or whether it's a numbness, a sharp pain, maybe it's an ache, that sort of thing.
Yeah.
How do we know which is, I don't know, worse? And how do we know what is preventable versus what needs extra help?
It's a great question. You know, I think to kind of start diving into it and understanding the foundation of it, what's first kind of important is to understand a little bit of how the spine is structured and its role. And so the spine is, really simplistically just a stack of bones kind of that run from the base of our skull down to our tailbone. And between each of those bones is a what's called an intervertebral disc, which is essentially a cushion. It's kind of like the sole of a tennis shoe. And around this stack of bricks and cushions are very strong rubber bands and ropes kind of that prevent it from sliding out of place or tipping over the wrong way. But as you can imagine, this is a flexible structure. The job of that structure is to balance as our hips move, as we walk, as we sit, as we turn and twist and play golf or pick up something from the ground or whatnot. The job of this biomechanical structure is to balance our motion of our lower half and our upper half and allow us to make these kind of different postures and motions. The other critically important role of our spine that's separate from the biomechanical nature is that it houses the spinal cord and spinal nerves. And so it's the main information conduit from our brain to the rest of our body. And in that way, I like to think of it as kind of a highway system where you have main lanes of traffic where all the information is flowing. And then at defined intervals, you have exit lanes and exit ramps as certain specific nerves exit that spinal column and travel into the arms, to the fingers, to the chest, to the legs, to essentially every musculoskeletal component of our body and sensory. And so when you think about the two functions of the spine, you can start breaking down kind of just conceptually where some of the pain can come from. And so, like any other joint in our body, and like I said, this is a huge stack of bricks. So every one of those intersections of the disc and the brick is, or the spacer and the brick, so to say, it can be seen as a joint. And so your hip, for example, is one joint. It's a ball and socket traditionally, right? That's how it's described. And that's one joint. And you can have a problem in that one joint. For the spine, each of those discs can be viewed as a joint. And then, in fact, to get into the weeds a little, there are additional kind of bony articulations or tiny joints, as we say, which are called facets, which also glide on one another. And so for each level of disc, there's essentially three joints. And if we just look in our lumbar spine, there are 5 lumbar bones and 5 discs. And so you're looking at 15 possible joints there just in the lower back that can have arthritic joint pain. Put on top of that the fact that nerves are running around these joints, they're running past them and through them. And as they get arthritic and bone spurs or disc bulges, and a disc bulge is essentially when that spacer, when that tennis shoe sole, so to say, it starts failing and it starts flattening out and you get pooches. You get like a pooch of that disc into areas where it wasn't before. And another analogy about how to think about discs that I like a lot is I think about them like grapes. They're like a really kind of firm, tough grape, but and as it ages, you can get little rips in the rind of the grape and some of the fruit can come out. And that's a disc herniation or disc bulge. And your body most of the time actually does a good job cleaning up that kind of disc bulge or extruded fruit, so to say. But it doesn't do a great job regenerating that grape. And so after you've had a disc bulge or many rips and time moves forward, that grape becomes much more like a raisin. And you can imagine the raisin does a much worse job cushioning the two kind of bones. And so you get more bone kind of rubbing on bone and more arthritic changes and kind of this never ending cycle. So when you start thinking about which pain is good, which pain is bad, in general, nerve pain is bad, and there's varying degrees of nerve pain. And nerve pain is what you've described as that numbness, or sciatica is, commonly what people call it. And sciatica is a general term, really. I mean, in medicine, it's a specific term for the sciatic nerve. But in reality, any of those nerves leaving that highway system, taking those exit ramps, can get a version of sciatica, so to say. We call that radiculopathy. That means irritation of the radicular nerve or of the nerve that's leaving the highway. And that type of pain is pain that or numbness or tingling that shoots in kind of a band down the arm to the fingers or down the leg towards the foot, front of the thigh, side of the thigh, back of the thigh. Each one of those regions is a different nerve. And when a nerve gets irritated, much like hitting your funny bone in your elbow, that's your ulnar nerve. That's a nerve that feeds your hand. And when you bump your funny bone, you get that tingling that shoots into your pinky finger and ring finger. And that's nerve irritation. And the same thing can happen in your neck or your back. And a disc bulge or a bone spur, or, God forbid, some sort of trauma, an accident, a tumor, things that are more rare, but, unfortunately, things that we see, that can start pressing on the nerve. And if it just brushes the nerve gently, you'll get maybe like a little zing or tingling here or there. If it presses on the nerve harder, you'll get numbness in that region and pain. And if it pushes on the nerve quite hard, the nerve will shut off and you'll lose strength of the muscle that is fed by that nerve. And if you get to that point, then that's an emergency like situation. Once the nerve gets turned off, once the pressure is so high that the power to a muscle gets turned off, there's a chance that the power won't turn back on. And so one of the best things that you can do in those situations are that if you're experiencing those symptoms, you need to see a physician, you need to see a surgeon really as soon as possible. And there's a few kind of, scary things out there that primary care doctors, et cetera, talk about. There's a syndrome called Cauda-Equina syndrome, which is where many of those lanes of traffic are shut down from a large bulge. It blocks the whole highway, so to say, not just an exit ramp. And you can have extreme pain in both of your legs and lose control of your bowel and bladder function, because those are also nerves that control your ability to hold your stool and urine. And obviously that's an emergency. But the majority of pain that people will experience in their life, where those WHO statistics come from, where, I'm sure that, Mike, that people who have back pain, you experience it yourself. I experience pain myself. The majority of pain that we experience is not as much of that nerve pain. You may have a twinge of it here or there, but it's the lesser feature. The majority of what people experience is that arthritic biomechanical pain related to the stack of bricks, so to say, and the arthritic changes of the spine kind of therein. And that type of pain is one that is often best managed with lifestyle changes and kind of a little bit of tough love, so to say. Gravity is our common enemy here, and the spine is very worn under gravity. And one of our best kind of things to fight those aging changes are keeping our weight down, keeping our core strength up, maintaining good posture, maintaining activity level. And so much like if you're in very bad running shape, so to say, going out and deciding to run, a 5K or something like that would be very difficult, right? It would be, it would feel really bad, and you may give up running that same day and never return. And sometimes that's what happens to folks with their backs too, right? They've been inactive for a while. They have this back pain, not much shooting pain in their legs, but their back hurts in the morning, hurts through the day. They do less. They stopped playing golf. They stopped going for their walks. They kind of become more sedentary. The problems only become worse. And then they overdo it one day. They go for a long walk and then they say, "Oh, my back hurts too bad. I can't do anything." Well, it's just because we did too much. And so it's the consistent effort to maintain activity, which is the most beneficial. There was a study out of Australia last year, and it's one I really like to kind of, it tells me something that I tell my patients all the time. It sounds silly, but the most important, the most impactful activity that any person can do to help with generalized low back pain is just walking, period. Walking for 30 minutes, 5 days out of the week. As quickly or as slowly as you want, but 30 minutes. It will help your overall health. It will increase the core musculature of your low back. It will increase the flexibility of those disc spaces, and consistent effort at just that simple task over 3 to 6 months will improve low back pain and your quality of life substantially. It just takes a little bit of consistent effort. So I rambled for quite a bit there, Mike. I'm not sure if I answered your question, but that was a spiel.
Yeah, I mean, it's fascinating how, when you think about it, doing too much can very often be a bad thing. Doing not enough can very often be a bad thing. Finding the sweet spot for a lot of people is the challenge. And then you hear talk about, okay, well, if you overdo it, then maybe you'll adapt. Maybe
Mm,
you'll get stronger. Maybe you'll
mm,
get fitter to the point where that pain's no longer felt, and then you do more, and you have this kind of spiral upwards in terms of
yeah.
your health and fitness, and then as you mentioned, if you don't do enough, the spiral can also work downwards,
Mm,
whereby pain kicks in, you then don't want to do it because you're in pain to start with. I mean, I tried going for a walk when I felt a bit of a twinge, and I could tell you there was a very, very big difference between a walk when you're in pain to
hmm.
start with, and then a walk when you're not in pain to start
Yeah.
with. This natural lean away from pain is part of this spiral downwards, and yet we're told that we can't overdo it because of this, that, and the other, and then it shifts as we get
Hmm.
older. How do you navigate this? Because I'm starting to get the feeling we need the sweet spot, which is, I
Yeah.
imagine, personal, but then where do we go from here?
It's a great question, and it's a not a one size fits all, as you reference. It's a very personal pursuit. And so, if I'm guiding someone through kind of, couch to 5K style, how do I get this stuff under control? What I usually kind of a multifaceted approach. And so the first thing to do is, I'd like to understand what your current symptomatology is. How bad is it right now? What are we dealing with? And let's say that it's mild to moderate. You feel it every day, but you're and some days are bad, but you get through the days. No red flag symptoms. I don't hear that you have the shooting pain that's been months and things like that. If I hear that, I'll recommend the patient gets an MRI and that we look for nerve compression. But let's say that that's the minor component. We're just talking about that kind of intermittent run of the mill back pain that can be quite debilitating, but it's what we live with as a kind of a population. So, top down, the first level I'll do and recommend discussing is kind of current activity level, nutrition, and weight. What is your current body weight? Where has it been before? Are you happy with it? What are we looking at? What's your current activity level? What are you doing every day? How many steps do you get in? How much time do you spend on your feet? What's your day to day look like? Just get an understanding of a baseline. What's your diet look like? How do you, how much of your food is antioxidative? How many green leafy vegetables are you getting? Omega 3s? How many processed foods are you having? What are we looking at? Obviously, what other major health issues like diabetes and heart disease, all of that important, but you know, let's talk about the non kind of real medical stuff. Let's talk about the quality stuff. Um, let's talk about kind of the what each person can think about on their own. And then smoking. Smoking is bad for the back. It increases inflammation. The smoke chemicals and the nicotine in general is not good. And that includes vaping too. The nicotine in your system is not good for the health of your discs. And that's been shown time and time again. Now, we start with a baseline there and we try to understand, where we are in the scope of your activity and existence. And we can make minor changes to each of those, right? If you're overweight, we have to try to start losing weight, right? If we're not active, we look at your activity. Okay, you have back pain, but are you walking 30 minutes a day, on average, 30 minutes a day of activity, 5 days a week? And if you're not, if you don't hit that level of activity, then we need to start working to get you first to that stepping stone. First, just that one, right? And so starting with that is just starting just start a gentle walk for 30 minutes or as long as you can. and see where you get, right? Just a low buy-in. And don't overcommit. Don't think I'm going to start yoga and Pilates and I'm going to do sit-ups and I'm going to do it. No, just start with the walk. Keep it low. And then if you're having pain with that endeavor, have you taken, Tylenol or acetaminophen? Do you take Advil or, ibuprofen, Motrins, things like that, anti-inflammatories? Because if you don't, this would be a good time to start taking them because we might need to get you over that hump, just the over-the-counter stuff, you know. But anti-inflammatories, anti-pain medications, just start them at this low level so that you can kind of jumpstart your activity level and get going again. And I would start them right there and just start there and do that. If they're very debilitated and they're not really active in any way, just start there. Stage two is more involved, right? Stage two focuses, and this is what, most of my patients, I'm in practice in Los Angeles, and our group, we have a very close working relationship with the Red Bull sports team. And so, what most of these guys are and girls are active people, very active actually. And what we talk about in them, as and there's a lot of times when they're getting a little bit older, they've really done a lot of crazy stuff in their life, and they've your backs, tell the story of that. And now they're a little bit older, and they're like, how do I manage this moving forward? And yeah, we're not going to be ramping dirt bikes or anything like that anymore. But the things we can do to really focus on this is very much focus on your posture and your core strength. And by core strength, I don't mean your abs. This is not, beach body land. This is your low back and your deep core. And so things like planks and low back extensions. If you're a gym goer, the Roman chair is fantastic. That's kind of a low back extension machine. And the key here is low weight, high reps. Don't go high weight. You'll pull a muscle. You push your limit too far. It's for example, just a quick aside, golf is one of the hardest things on your back activity wise you can do. And people think about it like, why is it, it doesn't, you're not pulling a lot of weight, you're not doing it's because fundamentally, for anyone who plays golf or any swinging sport, baseball or cricket or whatever, what stops you? What stops that swing at the full end of the backswing and the follow through? Like what makes that bat or club stop moving? It's not a conscious decision, really. It's my body doesn't go any further. Right? After the follow through, after I, hit that baseball or whatever, why does the bat stop on the other end? And it's because the body doesn't go any further. And what doesn't go any farther? Well, the spine, the spine, the discs, and those strong ligaments that bind it all together. And the more we twist it, the more we get those micro rips, right? The more we get those disc rips, the more we get ligamentous stretching, and the more we hurt our back. And so when you're functioning on the limits of what you think, what your body lets you do, when you lift that really heavy weight and your form becomes bad and your back rounds and you don't keep it flat and firm and your core engaged, you're really stressing your spine. And so to bring it back, the high reps, low weight is really a focus on posture and never letting, for your back, for example, or for your neck, avoiding that chin to chest kind of down looking view, or on your back, avoiding that rounding slouch, kind of the thinking man pose of your low back. Keep that back flat, like a standing position, where it kind of, it's you stick your butt out a little bit. That's going to be the best, most kind of protective position for your back. And so strengthening in positions to maintain your back in that position, strengthening the twisting, right? Not to the end of twisting, but just 50% of kind of your range of motion to maintain your lateral abdominal muscles and lateral back muscles. Planks are great. And then, adapting that improved posture in every aspect of your life. So when you're sitting in the chair, right? That's why those balls, the sitting balls for the desks became so popular for so long, and you still see them around, because to sit on that, you have to like, keep your low back straight. If you round your low back, you'll fall off the chair, you'll roll back, or you'll roll off the ball, you'll fall back off of it. But if you keep your kind of back flat, butt planted down, you can maintain your balance, and it just forces you to maintain that good balance. And so for a lot of these people who have chronic back pains and things like that, and they hurt their back in their 20s and 30s, and they kept going because they're just active people and they fought through it. Now they're in their 40s and 50s, et cetera, and their back hurts kind of day in, day out. And you have to make these postural systematic changes and focus on really strengthening that lower back and improving flexibility through your hips and the core in general. And you do that day in and day out, and you commit to that. Kind of that's like level 2, 3, not just the walking thing, but level 2, 3, really committing that low back strength and posture. After a year of that, you'll have less back pain, guaranteed, guaranteed.
What I find interesting as well is this balance between balance and stability and being able to hold the position. And then this idea of being flexible and being able
Hmm.
to move and rotate. I find that there's a balance to be struck with that. How would you suppose someone do that?
Yeah, agree 100%. What people, I think what most of us don't realize is that when we're talking about flexibility, what you're really talking about is hip flexibility. It's kind of crazy. We think about, oh, I need to strengthen and loosen my back. But when you really look at it, when you do these dynamic x-rays or moving x-rays, as we call them, when you're moving through your range of motion, your back doesn't move all that much. A little, but its main job is like a stabilizer function. Its main job is to make micro adjustments here and there. And you can kind of test this yourself a little bit. Like if you imagine, if you're even just sitting in the chair and you think about your hip bones, your femurs, right there on each side, and you hold them perfectly still. You don't let them move at all. And then you twist left to right and see how far you can twist without letting your hips move at all from your seat of your chair. You're going to get maybe 15 degrees in each direction, as an adult. And if you try to arch and extend your lower back without letting your hips move in any way by having your hands on your hips, you're going to get maybe 20, maybe 30 degrees of motion. And when we bend over and pick up things from the ground, and when we, reach to touch our toe, our left toe or right toe, or we do these yoga poses, what we're really doing is using our hip flexibility to really get us to those, great postural poses. And you feel that pull through your hamstrings when you try to touch your toes. And what do you do when you can't touch your toes? You round your back, right? You put a cat position of your back to try to get that extra little bit, because that's the back doing its job. It says, oh, we can't quite get there. Let me, give you what I got. But that's not good for your back. That is your back trying to help you, but you're not helping it. And so you can go full on, really pedal to the metal, so to say, with hip flexibility. And that's anterior hip flexibility. So front of your thigh, kind of a lunge position, stretching the front of that trailing leg, and just simply bending over and touching your toe position, and then strengthening those muscles there in your hip flexor and extensors, your gluteal, your butt muscles, your quadriceps, your psoas muscle, which allow you to pull your knee towards your body. And the back flexibility is actually a minor component compared to that. And it's good to maintain a level of back flexibility, kind of what I would describe as your run of the mill, your journeyman's yoga, your kind of typical yoga, the yoga I go to. I'm not a yogi or anything like that, but the stuff that most of us kind of participate in, that's good. That's a good amount of flexibility. Committing to becoming pretzel man and things like that, that can actually be, as you say, and it's this balance. Too much of a good thing can be a bad thing. Becoming too flexible in your back, really pushing the envelope, that can be not a great thing. But in the hips, you can go for broke.
So, what would you say were red flags to avoid and look out for? And then, if there are any, green flags in terms of back health and spine health?
Yeah, great. So the red flags are, really red flags, meaning things I worry about are those nerve symptoms that we kind of discussed before, really. Things like pain that shoots down your leg that doesn't get better after, if you, so again, the spectrum really is pain, then numbness, then weakness. And it's typically, very typically in that order. If you have a bit of pain, sciatica type pain, that's not a red flag to me if it, as it just at the beginning of it, as it starts. That's a maybe peel back a little bit, maybe, you know, take a week off, take 2 weeks off, let it try to calm down, take your Advil, try to let it calm down. Walk if you can. Walking is great for nerve pain, but maybe if you, became a Pilates instructor or something, calm down on that for a minute. If that pain persists more than 6 weeks, it's typically the recommendation to at that point we use I will usually order an MRI for you and get you an MRI in my practice because it means that despite your best efforts, the pain is persistent, and that's worth a look. Now, we may find a herniated disc or something like that. It doesn't necessarily mean you'll need surgery. It means that, we can try a steroid shot or we can try a steroid injection. We can prescribe, one thing I really like for herniated discs, and this is a little bit of an aside from your question, but, is distraction therapy or tilt table anti-gravity. Because again, gravity is our enemy here. If we can avoid the effect of gravity a little bit each day, we may turn the tides of the war, so to say, and we may be able to resorb that disc herniation, or our body may break it down. And the majority of disc herniations, meaning over 50%, resolve without surgery. And so, that's something that if you have a bit of pain, a bit of sciatica here or there, and it seems to be a relatively isolated event, or it gets better after a month, it's not typically something to worry about. If you have recurrent symptoms of sciatica that are frequent, or radiculopathy, as we described earlier, it's worth talking to a doctor about it. It's worth maybe getting a picture just to see what's going on. Picture, I mean MRI. Now, if you have numbness or weakness, and that numbness stretches down one of those kind of stripes, where the nerve runs, front of the leg, side of the leg, back of the leg, anywhere, obviously in the kind of saddle region, or same analogies for the arms, down the arm to the hand. That's something that should get imaging, and we should look into from as your physician should, or your surgeon. And weakness obviously is a red flag. Um, the musculoskeletal things, kind of like, to me, a red flag for low back pain is if it's severe and doesn't get better. But I've had muscle strains and what we call capsule strains, which is a strain of one of those tiny joints in the lower back, one of the three at each level, and it just can be incredibly painful. But it typically resolves after a week or two, right? And it just prevents me from wanting to twist much or pick anything heavy up. Those things I don't worry too much about, to be totally honest. If you're not having nerve shooting pains in the back, you can usually keep it under control with some ice, some heat, gentle massage, yeah, some, anti-inflammatories, and give it a week or two. And that's just kind of your typical, I hurt my back type of activity. Um, and the more if your posture gets bad, or if you overdo it, you may run into one of those things. But really, in general, if you start slow, stay consistent, and maintain good posture during your exercises, good form, and it's worth talking to a trainer or a physical therapist if you're unsure what that means, and really build those in to your activity level, you should be okay, to be totally honest. Now, green flags, you're just going to, a green flag to me is, if, and when people have pain and chronic pain and they experience pain, I always, because our minds forget quickly, I encourage people to keep a journal. And, you can make that 0 to 10 pain scale, write in it every morning or every night, and just talk about your back pain and what you did. And the mind forgets. You may be doing this for a month or two and you think, oh, my back, it still hurts, it doesn't, I'm not better. And then you look back in your journal and you realize that, you know, 3 months ago, you weren't able to go to the park with your kids or your grandkids or whatever because you couldn't do that. And now you do that every day. And you have a bit of back pain, maybe, but compared to where we were a couple months ago, we're doing much better. And you can use that as encouragement to know that a couple more months and you may even be doing better. So it's good to track your progress and be explicit about your progress, kind of with note taking helps us remember.
Awesome, Joel. That's quite a good way of thinking about it as well, because I can't imagine a space where if you look back over your progress, you would likely have a better understanding of your actual situation. Because as you said, we can forget things. Maybe we're caught in the moment of my back hurts now, but I've had 5 days without, and I've never had that before. So it's interesting when you point that out because very often we can get caught in the pain and the suffering part of it without looking at the positive as well.
Yeah, it's that whole it's the mindfulness type thing, right? Just applying a mindfulness and a awareness to the day to day. And the mind body connection for spine health is as true as with any system in the of your whole body. You know, gut health, spine health, mental health. You know, ability to be mindful and deliberate about your experience and the moment and your progress is I think critical to the path ahead.
Is there anything outside of core strength, walking, hip flexibility that can be key in back health? So this is coming at it from leaving no stone unturned.
Yeah, absolutely. It's great because we've talked this hour about all the things outside of the operating room, which I'm really happy to do because most of my days are spent in the operating room, and I really enjoy when I can help keep people as much. I'm a surgeon. I love doing surgery, but I love keeping people out of the operating room if I can. And to your point, the best evidence we have for spine health things, you can kind of look at it this tier, and what we've talked about already are the highest level evidence: activity, weight, strengthening. Those are the best level evidence. Non-smoking. Okay, if we take one level down where we don't have as good of evidence from the studies and things like that, but it seems reasonable and there's some evidence and a lot of experts agree. Type of diet is important. So, not less processed foods, more holistic foods, whole vegetables, right? Low glycemic index foods, keeping your sugars down, keeping your oxidants low. Seems to matter with kind of full body, chronic body inflammation. Keeping fiber high, things like that. It seems to matter. Kind of mental wellness seems to matter a lot, an awful lot about how our body interprets back pain and how we're able to deal with it. And so a lot of times when our mood is bad, our pain is worse, and then our pain is worse, and our mood is worse. And that is a critical thing to be aware of and to help yourself treat and understand if that's a cycle that you're in and get the help you need. There are a lot of other things that are done for spine health that can be beneficial. Chiropractic, um, ultrasound therapies, PRP injections, um, THC rubs, CBD rubs, different oils. They're all kind of this low. I mean, PRP is improving, and some chiropractic stuff is excellent. Absolutely, I'm sure. But it's a little bit of a mixed bag there, and it's kind of a use by use basis, in my opinion. Some things help certainly, and maybe it helps that mind body connection. You believe you're getting better, and therefore you are getting better, and that's powerful. And I'm all for it. Um, and these endeavors to undergo at those levels, really what I ask patients are, when they're thinking about it is, what's the buy-in, so to say. Is it injection? Could something happen in that injection? Is there risk? What's the buy-in financially? Some of these things are, cash-based, etc. So what's the buy-in? Um, if the buy-in's low and it feels reasonable to you, and you have talked to a doctor, or chiropractor, or provider, or whatever, and you trust them and they have good reviews, and you've done your diligence, and you want to try, go for it. But it's those things are generally lower level evidence than that top of the pyramid, which is kind of the your own stuff thing. And then, there are a lot of patients who are doing this self-care thing great, and they're really doing it, but they still have something that hurts. They have a pain that shoots down occasionally, and it's the last thing. It's the last thing before they're able to do that half marathon or train for it consistently or really get active again surfing or whatnot. And to be totally honest with you, that's where I love to come in, because these patients have really taken control of their life, and they've done a great job, and they've really committed. And often when we've gotten to that level, we can find that one little bone spur. We can find that one little thing. And in those situations, if it hasn't gotten better, we can do tiny surgeries, endoscopic type surgeries where the incision's the size of a fingernail, and you're going home an hour after the procedure, right? Surgeries that are really focused on not giving you that big buy-in, so to say, right? Giving you just an opportunity to get back to the life that you see for yourself that you want to get to. And a lot of times we can identify those when patients take control of the rest. When patients are unable to take control of kind of those first stages, and they come in, and it's very difficult because there are a lot of problems, and a lot of degeneration in the back and a lot of pain, and the patient is somewhat deconditioned. And those are the situations, in my opinion, where in many ways spine surgery has gotten kind of a bad name over the last couple decades, because maybe historically, and currently maybe, but historically maybe we were too aggressive, or believed that too many things would help, or fusions were good, and we try to run away from fusions when we can now. And at the end of the day, the obstacle is too great, right? We're too far in the hole really to get out of it well. And that happens sometimes. And we need to be able to recognize those times. There's limitations to what surgery, can do. It's not a magic wand.
I imagine that the preventative approach would be better than waiting for things to get bad.
Yes, I agree.
So for those that would like to enter your world a little bit, Joel, so this conversation's been very enlightening. I'm already making notes for the things that I can do. But for those that are curious to take things further, how can people connect with you?
Great. Yeah, I'm happy to talk about these things. Or if people are experiencing back pain, or want to talk about their spine health or want a second opinion, easiest way to find me here is just becketspine.com. That's Beckett spine.com. And there's contact links and, informational things on that website. And happy to talk about this stuff all day. I love it.
Thanks so much for being a guest on the show. Those that are listening, feel free to subscribe, share the show, tell others, and also leave a review wherever you are listening into your podcasts. Joel, it's been great. Thanks so much. And I look forward to keeping in touch. Thank you.
Thanks, Mike.